Sulfadiazine is a medication used to treat and prevent a wide variety of infections. It belongs to the class of drugs known as sulfa antibiotics and works by stopping the growth of bacteria and other organisms. It should only be used to treat certain types of infections and will not work for viral infections such as the common cold or flu. It's important to note that unnecessary use or misuse of any antibiotic can lead to decreased effectiveness. This medication should not be used in infants younger than 2 months, unless it's for a very serious infection such as congenital toxoplasmosis. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional based on your specific condition. When taking sulfadiazine, make sure to take it with a full glass of water as directed by your doctor. It's important to drink plenty of fluids while taking this medication, unless your doctor advises otherwise, to help prevent unlikely side effects such as crystals appearing in the urine and kidney stones. The dosage of sulfadiazine is based on your medical condition, weight, and response to treatment. It's best to take this antibiotic at evenly spaced times, such as at the same times every day, for the best effect. Remember to continue taking this medication for the full time prescribed, even if your symptoms disappear after a few days, to prevent a return of the infection. Be sure to inform your doctor if your condition lasts or gets worse. Side effects of sulfadiazine may include nausea, vomiting, diarrhea, loss of appetite, headache, mental/mood changes, signs of kidney problems, goiter, low blood sugar, severe intestinal condition, oral thrush, vaginal yeast infection, severe allergic reactions, peeling skin rash, blood disorders, liver damage, and lung injury. If you experience any of these symptoms, it's important to contact your doctor right away. Additionally, do not use anti-diarrhea or opioid products if you have diarrhea, and contact your doctor if you notice any new symptoms. Remember to seek medical help immediately if you experience severe side effects such as a severe or persistent headache, confusion, seizures, or signs of a new infection. And as always, if you notice any other effects, make sure to contact your doctor or pharmacist. Before starting to take sulfadiazine, make sure to inform your doctor or pharmacist if you have any allergies, especially to sulfa medications. It's also important to discuss your medical history, including metabolic disorders, kidney or liver disease, severe allergies, asthma, diabetes, blood disorders, and bone marrow function. It's essential to let your healthcare professional know if you are using sulfadiazine before getting any immunizations or vaccinations, as it may affect the effectiveness of live bacterial vaccines. Also, be cautious about sun exposure while taking sulfadiazine, as it may make your skin more sensitive to the sun. It's recommended to limit time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. For older adults, it's important to be aware that they may be more sensitive to the side effects of the drug, especially skin reactions and blood disorders. If you are pregnant, discuss with your doctor whether the benefits of taking sulfadiazine outweigh the potential risks. It's important to note that this medication should not be used near the expected delivery date due to the possible harm to the unborn baby. Additionally, if you are breastfeeding, consult your doctor before doing so, as sulfadiazine can pass into breast milk and may have undesirable effects on certain infants with disorders. When taking sulfadiazine, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with sulfadiazine include methenamine, methotrexate, PABA taken by mouth, and warfarin. It's important to discuss these potential interactions with your healthcare provider to ensure the safe and effective use of sulfadiazine. If you suspect an overdose of sulfadiazine and the person is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can call 1-800-222-1222 for your local poison control center. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include dizziness, drowsiness, blood in the urine, fever, and loss of consciousness. Do not give this medication to anyone else. This medication is prescribed specifically for your current condition. Do not use it for another infection in the future unless instructed by your doctor. If you are taking this medication for a long time, you may need to have lab tests done to monitor your blood count and kidney function. Make sure to keep all of your medical and lab appointments and consult your doctor for more details. If you forget to take a dose of sulfadiazine, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one. Take your next dose at the usual time and do not take double the dose to make up for the missed one. Make sure to store sulfadiazine at room temperature, away from light and moisture. Keep it in a place that is out of reach of children and pets. Do not store it in the bathroom. When you no longer need the medication, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, do not flush sulfadiazine down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.